I'm Dr. Anna Saylor with the Every Family Chiropractic Center, and I want to talk to you about headaches due to weather changing. So, number one thing we've seen over the last week is a lot of our patients coming in with severe headaches or migraines, especially like the kind that you're like, my head just hurts so bad, and you see it in your eyebrows, and you have that tension in your face. And that's like one of the number one things we've seen all week. And when you see something over and over and over again, you have to look at like why, the causes why. Number one thing we find is actually headaches are caused by weather changing. So it kind of seems like weird, but Michigan's weather right now is crazy. So, 2 weeks ago we had snow and now we have sun and we're going into like 80-degree weather. So the severe changing in weather really can affect or trigger migraines and trigger headaches. Um, Bright sunlight, extreme, cold to hot, different even in the same day. Like we don't even know how to dress right now. So we're seeing that triggering a lot of headaches because of that extreme starting in the morning being cold and then going to a lot hotter in the day. The sun glaring. So I love having sun, but like we forget, like we have to bust out our sunglasses right now. So when it's sunny out, we want to make sure that that is not causing triggered migraines. High humidity, dry air, a lot of different things. But let's actually talk about the barometric pressure changes because that's one thing people hear about and they don't really think the whys. So barometric changes can actually change brain chemistry. So it can increase things like serotonin in your brain. And serotonin usually is like, okay, let's see what's going on. But if you think about just a flood of different chemicals, different hormones, it's not a toxin to your system, but if your body's not used to something and it gets a flood of some kind of chemical, it can actually cause like a toxic reaction. The other thing that happens with barometric pressures is it can change the way the blood flows. So you don't think about your blood flowing and your circulation going, and it's just natural for your body to pump fluid. But if you have barometric pressure and it's squeezing things, it's condensing things, anything that's blood flow is getting condensed into areas that can't really move. So you think about your teeth, so if you have this squeezing pressure, you're going to feel it in your joints, you're going to feel it in your teeth, and you're going to feel it in your skull because those are areas that can't really expand and contract. Like your skin can expand and contract, your muscles can expand and contract, but areas that are stiff, like a bone, a joint, teeth, and skull, can't really do that expanding and contracting. So if you have barometric pressure changes that are just squeezing everything, the fluid gets squeezed into those areas. That's why a lot of times people are like, oh, just like I have so much pressure in my sinus. I have so much pressure here, or so much pressure here, and I just want to like push on it. Those are because of that barometric pressure squeezing. And then when the pressure releases, that's when everything just feels like, okay, pressure releases off your face, pressure releases off like your whole body because it's releasing that squeezing. The other thing that it can be triggered by, and you don't even think about it, but if you're already stressed and you're already not in stress, think about if you're stressed. Everything is tight. Everything, especially women, we carry our tension in our neck and shoulders. So we already have this tight neck and tight shoulders, and we're already kind of squeezed in. And then you take a pressure squeezing, and it makes it even worse. So that's where those trigger migraines are happening. That's where those headaches are coming from because we're already tense in this society right now. I mean, we're in the middle of, little craziness going on. So we're already stressed out. And then we're tense because of that stress. And then we throw a barometric pressure change on that. It's just like, it's like the straw that broke the camel's back. It's that one last thing. Okay. I know they can also be frustrating. So if you think about it, you can't change the weather. You can't. You can't control the weather. You can't change it, but you can also go, okay, if you're looking at what's going to happen weather-wise, you can look at the things that you can control. So you can control your body's reaction. You can control getting adjusted. You can control your stress level. You can control how much water you're drinking because if you're hydrated and you have more fluid in your bodies, it's going to be harder to squeeze it. So think about those things that you can control and making sure that you are in control of your health that way. So especially going, okay, I normally get a headache when this happens. let's go, what else can I do to make sure I don't get a headache? That number one thing, get adjusted, because we can adjust your cranials, we can adjust your sinus cavities, we can adjust your neck to allow the fluid to drain. So number one thing for us is definitely getting adjusted, especially if you know that there's a huge trigger coming. Like right now, weather's going to be beautiful, but we're coming off of this crazy rainy stuff. Make sure you get adjusted tomorrow. Call the office and say, hey, I know I need to get adjusted. But also making sure that you're doing the things that you need to do. What can you do to relieve your stress today? Can you drink a little bit more water today? Can you be a little more proactive in taking control of your health today? So hopefully that gives you a little idea why, we see it all the time. People are like, can weather really affect it? Yes, it really can. Maybe not in some place that's really consistent with their weather and they don't have these crazy up and downs like Michigan do, or Michigan does. But Michigan is well known for the craziness. Like you wake up and it's 30, you go to bed and it's 80. So think about that and just kind of look at the things that you can do to help your migraines and headaches. So hopefully that helps. I'm Dr. Anna Saylor with Every Family Chiropractic Center, and we look forward to seeing you. Bye, everybody.